this Monday?
Sure, Sunny. Well, despite the lower number of tests usually conducted over the weekend, this Monday, Korea reported more daily cases than on Saturday and Sunday. So if we start by taking a look at our graph here, we headed into the weekend with over 150 cases, but then we did plunge to 70s and even 60s, but now we are back to the 100s at 119 cases. And a little over 6,100 people have been screened for COVID-19 on Sunday, and almost 2% of those tested positive for the coronavirus. And the positivity rate the day before was at 1.12%. And with that, Korea now has a total of 25,955 cases. 457 is the death toll, remaining unchanged from the day before. And a little less than 1,600 people are in quarantine, while over 23,900 people have made a full recovery from the condition. And moving over to our map now, we see 67 new infections in Gyeonggi-do province, followed by 20 in the capital Seoul and 3 in Incheon, which means 90 cases in the metropolitan region alone. And 25 cases this Monday were categorized as cases from abroad.
I see. So, and starting today, the free vaccination program for people aged between 62 and 69 will continue, I hear.
Yes, Sunny. Following reports of dozens of fatalities recently among those who received the flu shot, there were growing fears regarding the safety of the influenza vaccination. But health authorities reiterated that there are no direct links between the deaths and the flu shots. And here is what the health minister said on Sunday.
Given the factors of temporal contiguity, underlying health conditions, and the autopsy results, we have determined that there are
8.8 million and fatalities have surpassed 230,000. And then France over the weekend, as well as Colombia, have surpassed the 1 million mark. Moving over to other places, we also have Italy and Chile, which surpassed 500,000 cases over the weekend. So resurgences are continuing, especially in Europe. And the WHO said in a recent briefing that especially the Northern Hemisphere is at a critical juncture in this pandemic. And those are the updates I have for now, but I'll be back with more after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back here at the desk later. Back on the local front, efforts to eliminate COVID-19 include a series of innovative gadgets aimed at stemming its spread. Now, in this next report, we touch upon a few of those gadgets, including a nasal spray and a detection device.
A team led by Professor Seo Sang-hee from Chungnam National University has developed the world's first nasal spray vaccine for COVID-19. Professor Seo tells us how he first came up with the idea.
독감은 뭐 백신 하지 않더라도 많은 사람 자연 면역이 있단 말이에요, 그죠? 그렇기 때문에 백신을 좀 권유하더라도 어느 정도 효과를 볼 수 있는데 이 신종 바이러스 경우는 사람 면역이 없기 때문에 그러니까 그냥 단순 그 근육 접종으로 이 방어를 하는 효능이 많이 떨어질 수밖에 없거든요. 그래서 코로나19는 당연히 호흡기 감염하니까 결국은 스프레이 방식으로 접종해야만이 제대로 면역성을 일으키기 때문에요. 스프레이 방식으로 하게 된 거지요. 예.
A group of 14 mice were spray tested with the vaccine in a lab setting, and all survived without any symptoms such as weight loss. Neutralizing antibodies that can ward off COVID-19 infection were also found within these mice.
곧 임상 실험을 해야 되고 그래서 뭐 1년 이상 걸리겠지만 그게 삼상 실험 결과에 따라서 속도는 좀 빨라지고 늦어지고 그럴 수 있지 않겠나 싶습니다.
Elsewhere, a team led by Professor Hwang Jung-ho from Yonsei University has developed a new gadget that can capture and amplify the coronavirus and the type A flu virus in just 10 minutes through a continuous air capture system. So just what happens inside this little box that allows it to capture viral particles that are floating in the air?
장치를 가동시키게 되면 주변 공기 중에 있는 바이러스가 장치 내부로 유입이 되고 유입된 바이러스는 전기적인 힘에 의해서 액체 위에 포집이 되게 됩니다. 액체 위에 포집된 바이러스는 바로 유체 채널로 들어가는데 유체 채널로 이송된 바이러스는 내부에 설치되어 있는 단백질과 흡착을 일으켜 농축을 하게 되고 농축된 샘플이 얻어지고 그 이후에 여기 보이는 PCR 장비에 들어감으로써 공기 중 바이러스의 농도를 측정할 수 있는 그런 원리입니다.
The team tested the machine in an environment where virus concentration levels are similar to that of areas where COVID-19 is rampant. In just 10 minutes, the machine successfully captured and amplified the virus.
신종 코로나 바이러스 같은 감염성 바이러스는 공기 중 농도가 매우 낮다고 알려져 있습니다. 그렇기 때문에 공기 중 바이러스를 PCR에 검출한 개 이상으로 포집하기 위해서는 기존에 10시간 이상이 걸렸는데 본 연구 개발에서는 공기 중 바이러스를 고농축하여서 포집 시간을 10분으로 단축시켰고 그에 따른 모니터링 시간이 매우 단축됐다고 말씀을 드릴 수 있습니다.
It took 6 long years for the research team to develop this technology. The device is expected to make an immediate impact when installed in public use facilities.
예를 들면은 비행기가 랜딩한 다음에 들어오는 출입국 사무소로 쭉 걸어오는 곳에다가 이런 걸 설치하면은 소위 검역이 굉장히 쉬워질 것 같고요. 병원 또는 이제 학교, 공공시설 등의 설치가 가능할 걸로 보고 있습니다.
These scientists and researchers are among the thousands who are working day and night to bring a speedy end to the COVID-19 pandemic.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular briefing on COVID-19 for this Monday. As reported by our Kwon-soo earlier, officials here have found no direct link between the flu shots and the recent fatalities of at least 48 people nationwide. Officials also shared statistics that show more than 6.6 million people aged 65 and older received flu shots between July 2019 and April 2020, and some 1,500 died within 7 days after the vaccinations from pre-existing health conditions. Having announced these findings, officials also pledged to continue with the free flu vaccination campaign. Meanwhile, there appears to be some concern over possible outbreaks at nightlife entertainment facilities this coming weekend in light of Halloween celebrations. Back in May, massive cluster infections were traced back to clubs and bars in Itaewon in central Seoul. Now, we're still waiting for the briefing to commence, and while we do, perhaps we can take a look at the guidelines under Level 1 social distancing here in the country. Now, there is no ban on public gatherings, but here in the metropolitan area, large-scale gatherings are still being discouraged. But should such events be held, authorities are calling for stringent safety practices and the proper spacing of people. Also, in the academic arena, schools nationwide have opened their doors wider, welcoming 2/3 of their student bodies to classrooms. Cram schools of more than 300 people have resumed classes too. Meanwhile, Gangnam district officials here in Seoul are providing COVID-19 testing to all tutors at cram schools in their region to prevent outbreaks within these learning environments ahead of the national scholastic test scheduled for early December. With regard to high-risk establishments and operations, clubs, bars, singing rooms, as well as buffet restaurants are among the 11 that can resume business, while door-to-door sales activities remain banned. 16 other public use facilities such as cafes and ordinary restaurants in the capital region face tough safety measures while open, but those in other regions across the country have less stringent guidelines to follow. Now, the guidelines in question have much to do with the seating arrangements and the spacing of patrons. At places of worship, in-person regular sermons are allowed here in the metropolitan area, but small group gatherings and meals are not. Elsewhere in the country, local authorities are being advised to draw up their own regulations depending on their respective situations. At sports stadiums, officials can have 30% of their seats filled with spectators. Government facilities, that is, such as museums and libraries, meanwhile, have a slightly higher capacity cap of 50%. At the workplace, remote working and flex time are being recommended at both private and public entities. Operations at social care centres, including those for children, have started as well. Now, we're still waiting for the briefing, and perhaps while we do, we can have a short talk that is, with our Kwon-soo about the situation on this Monday, right, Soo?
Sure. Well, let's take a look at today's figures again. Well, we have 119 cases, which is quite a surge from what we had over the weekend as we were down to the double digits. And usually we see a drop on Monday because we have less tests conducted over the weekend. So this is quite a concern here that we're in the triple digits again. So we might even have higher numbers as the week progresses. And as you mentioned earlier, this weekend is quite a concern due to Halloween coming up here in Korea. More and more young people are celebrating Halloween in the past years. And as we're down to social distancing measures at level 1, now clubs and bars are again operating, although under strict quarantine measures. That's why authorities are calling on extra vigilance this week, especially as we are now approaching winter and the weather is getting colder. And with the colder weather, that was raising concerns of a so-called twindemic here in the nation because of the seasonal influenza. And regarding that, we heard that beginning today, people aged between 62 and 69, I believe, are again continuing to get their flu shots, which will be free under a government program. And it looks like the government has reiterated that there seems to be no direct link between the recent deaths among people who got the flu shot. That was, as of Saturday, 48 cases. But speaking of that, authorities said they are not going to mention any additional deaths from now on among people who had the vaccine.
Right. They were also talking about how 1,500 people had passed away after getting their flu shots between July 19th and April 2020. These people numbered at 1,500, as we mentioned earlier. So the flu shots are believed to be safe for now because tests have shown no direct link, as you mentioned earlier. If we take a look at the situation, we are still waiting for the briefing that is supposed to start a little after 2. We have our consul with me for a bit of a talk while we wait for that briefing to start. Now, officials will probably touch upon the flu vaccine program that is going to continue, as authorities have found no direct link between the flu shots and the recent fatalities of at least 48 people nationwide as of this past Saturday, that is. And as our consul mentioned, the figures of, or the numbers related to deaths will not be announced anymore amid fears that it will raise unnecessary public concern over that reality, which officials have dismissed, keeping in mind or sharing with us the piece of information that about 1,500 people passed away between that would be July 2019 and April 2020 after receiving their flu shots, but from pre-existing health conditions. Right, we're still waiting for the briefing to start, so perhaps we can touch upon the figures for this Monday outside of Korea. You're talking about France, and I believe the briefing has started. We'll come back to you afterwards with a summary of that.
First of all, we have Commissioner Jung Eun-young with the explanation. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of October 26th, we have a total of 94 new local infections and 25 new imported cases. And the total caseload now stands at 25,955. Currently, we have 1,593 people in quarantine, and we have 53 patients with severe or critical conditions, and we had no additional fatality. And now let us look at the updates on our major domestic infections. And in relation to a family in Kurogu District, Seoul City, we also found that they were connected to the dance school in Bucheon City, and 13 more people have been confirmed to date. And in total, we have 40 people being confirmed to date. And in Gyeonggi-do Province, at a disabled facility, we also have the more cases being confirmed, and we have 37 more cases being confirmed, and 27 more cases being confirmed, with a total of 28 now, and 7 of them are the caregivers, and 1 are the visitor. And in relation to the 행복해 Nursing Hospital in Namyangju City, we have 10 additional cases being confirmed. In total, we have 59 cases being confirmed to date. In relation to them, we have 30 people who are inpatients, and 19 are caregivers, and also 10 additional cases as well. And in Gwangju City, we have the SRC Rehab Hospital, and 7 additional cases have been confirmed to date. And right now, we have 135 standing as a total of the total infections. And in relation to Gyeongnam Province, Changwon City Family Gathering, we also have additional cases being confirmed. 9 more have been confirmed, and a total of 10 people have been confirmed to date. And we see that this is a chain transmission stemming from a family gathering. And looking at our risk assessment indicators for the past week, here are some updates. The daily average of the new confirmed cases in Korea stood at 75.3, which is about 13 more cases compared to the previous week. And the imported cases, on average, we have about 20 cases, and it is a slight increase by 2 from the previous week. Looking at the sources of transmissions, we have seen 221, or about 33.1%, being stemming from the nursing hospitals and other hospitals. And we also have 140 imported cases as well. And this has been a slight increase from the previous week as well. And as for cluster infections, we also have about 25% and also 15% stemming from the contacts from the previous confirmed cases. And we also have about 10.2% which are under investigation, which is a slight decrease from the week before. And during this week, we had 14 fatalities. And on average, we have about 13 or so fatalities on an average. And as for the age group, those over the age of 80 had 6, and those over the age of 70, we had 2, and 6 also in their 60s. And all of them were above the age group of 60. And 12 of them had underlying illnesses. And also, we are also conducting other investigations in relation to this for the other 2 cases. Once again, I extend my deepest condolences to the deceased and the members of the bereaved families. And the fatality rates, it is a very high, standing at about 25% for those aged over the age of 80, and 7.1% for those in 70s, and also which is slightly lower in those aged between the age of 60 and 69 as well. And lately, we are seeing more exposure to the virus and more infections stemming from these nursing hospitals. And as we have a higher number of these senior citizens becoming contracted with the virus, we believe that we could see a rise in the number of fatalities, and we will also closely monitor the situation. And looking at the virus infection spread throughout the past week, we have about 3 risk factors. First is the fact that we have the facilities that are vulnerable to infections, including nursing hospitals and long-term care centers, which are stemming as the venues of the virus. And second, we have these virus spreading very fast at other countries as well, including those in Europe. And also third, we also have the chilly weather, which also we believe would be one of the factors in increasing the virus spread going forward. And we also conducted epidemiological investigation, and we also found that some of these facilities, multi-use facilities, did not abide stringently by the quarantine measures. So we would also like to intensify quarantine measures for these facilities. And we also found that there were some facilities which did not designate a responsible employee in charge of quarantine measures. And as for the new inpatients, we are mandating all of them to get tested. However, there were also some of the facilities that did not abide by such a protocol, and they also did not have full control over the number of visitors as well. And in relation to the COVID-19 virus, most of the nursing hospitals have a high number of patients within one single patient room, and these were also pointed out as one of the risk factors as well. And moreover, we have seen about 2 weeks, but we also saw up to 2 to 5 days until one had symptoms and until the person was tested at these facilities. So we believe that these could have exacerbated this situation as well. And of course, there were some of the cases where there were virus spread about 14% throughout a single facility and spreading to about 100% in a single facility as well. So we believe that there is a higher risk of infections at these facilities. And during the past week, we have initiated the massive testings for all of the inpatients and the care providers working at the nursing hospitals, working at the metropolitan area. And we are also mulling over expanding this massive testing to also those similar facilities in the non-metropolitan area as well. And we are also mandating the training and education as well as inspections for these facilities so that we can also strengthen the measures to be abided by the professional healthcare providers as well. And we will also provide in detail some education and training for these healthcare providers. And we will also expand the venues to include mental hospitals and rehab hospitals as well. And as for the nursing hospitals and long-term care centers, which house many senior citizens, many of them have underlying illnesses, and many of them are very seniors when they come to the age group. And also, we would like to mandate all of the people who are working there to abide by quarantine measures, such as including face mask and washing of their hands, and also get tested as soon as possible if they have symptoms. And also, we need to provide a restriction on the number of visitors, and we also need to highlight the importance of ventilation and disinfection as well. And second, we also had some risk factors stemming from imported cases, and many countries in Europe are also seeing more grave conditions of the COVID-19 spread, and we have over 41 million globally, and the fatality rate is also very high among other global countries as well. And we also have about more than 5,000 new deaths and on a daily basis when it comes to global tally, and it is also getting very severe. And against this backdrop, we have seen the need to intensify quarantine measures for those countries that have higher risk of infections, and we are also mandating them to get tested as soon as they arrive at the airport so we can contain the virus from spreading to the community level. And during the weekend, we also seen an increase in the number of group travels and social gatherings, and we also like to mandate you to abide by quarantine measures. And if you are also going to confined, crowded, and close contact environments, such as indoor gatherings and indoor events, please do not go there as much as possible. And if you have to go outside, and also if you are going on travel, please wear your face mask and wash your hands on a regular basis. And during this weekend, we believe that Halloween Day is coming up, and we believe that many people will visit nightlife entertainment venues. And please abide by quarantine measures such as wearing face masks even when you are at indoors, where keeping a healthy distance is difficult. And as for multi-use facilities and the gatherings, if you have symptoms after going to these facilities or gatherings, please get tested as soon as possible if you have suspected symptoms. And next, we would also like to provide you some updates on the influenza virus trend. During the past week, we have seen this is a week 42 of the surveillance against influenza vaccine, and we have seen the ratio of influenza, which is quite lower than the threshold of us determining as an outbreak. And we have continuing to conduct about inspections for 52 health clinics. We do not have a detection of the virus from these facilities yet. However, we have some samples where we have seen about 0.7% identification of the virus from these samples, and they were mostly type A and type B, and both of these types are being identified, and also most of them tested positive among the age group, those among the children under the age of 10. So we highlight the importance of getting public vaccination, and in order to ensure a safe vaccination, please make sure that you are getting vaccinated when you have good health conditions and when you do not have to wait for a very long time. And also when you are in line to wait for the vaccination, please drink plenty water, and also please notify the medical staff in prior to the vaccination if you have any underlying illnesses as well. And after getting vaccinated, please do not go home directly and watch your conditions for about 10 to 15 minutes. And for the next 2 to 3 days, monitor your conditions closely. And if you have dizziness or difficulties in breathing or other symptoms, please visit a health clinic as well. And also abide by the quarantine measures that are aimed at preventing influenza, which also include wearing a face mask and washing your hands, and also avoid going to crowded places. So these are the same quarantine measures for preventing COVID-19, so abide by them stringently. And we also have a few updates in relation to COVID-19 outbreak. Globally, we are seeing a resurgence of the virus on a global level, and we also have more than 450,000 cases on a global level on a daily basis, and especially those in the European region, including France, UK, Spain, and Italy. Many of the countries are seeing more than 10,000 cases on a regular basis as well, and they are also intensifying their lockdown. And also there are two simple responses against COVID-19, and first is to wear a face mask, and also second is to block the physical contact with the social distancing measures. And we believe that many countries are now intensifying their lockdowns in order to contain the virus. And after we have the first case of the COVID-19 in January here in South Korea, about 10 months have passed right now. Even though we are avoiding a massive outbreak, however, we still witness cluster infections, especially at vulnerable health facilities for the senior citizens. And this is why we need to intensify the quarantine measures for the high-risk group. However, it is also very important that we can reduce the risk factors throughout the community. And this is the only way to protect the vulnerable lives of the senior citizens as well. And throughout the past 10 months, we have learned how to combat against the virus. So let me once again highlight these responses. First is the period of the infections. And COVID-19, even before you develop symptoms, 2 days prior from developing symptoms, we believe that you can infect the virus to others. And especially these are the period of times when the infectious rate is actually very high. So this means that we have asymptomatic patients who could be silent spreaders among the community, and it is very hard for us to detect these patients. And this means also that you need to wear your face mask at any places that are crowded and any which are frequented by many people. And you could also protect the virus from invading you, and also you protect others from the virus as well. And it is very important to get testing as early as possible to combat the virus, and especially for the multi-use facilities, including nursing hospitals and long-term health care centers for the senior citizens. It is very important to facilitate testings as well. And also second is the way of infection. We believe that they are infectious through respiratory droplets, but also there are high risks of aerosol infections as well. And this means that the virus can spread at any place which is crowded, confined, and close contact environment. And if you have to inevitably go into these situations, please wear your face mask, and and also wash your hands and ventilate the space on a regular basis and disinfect multiple touched surfaces as well. And this also comes down to the importance of abiding by quarantine measures, including wearing your face mask and avoiding crowded, confined, and close contact environment, and washing of your hands, and also getting tested as soon as possible. So these very basic protocols need to practiced on a regular basis. And also, whether you are at an eatery, cafe, or a cinema or a sports complex, please also abide by these quarantine measures so we do not have an extensive lockdown and we can guarantee daily routines. Thank you very much.
Right, that was Jun-seong, the commissioner of the KDCA, with Monday's afternoon briefing. So, do give us a short summary of what she said today.
Sure. The average of daily cases in the past week was at 75, which is 13 up from the previous week, and 33% of these cases were linked to hospitals and nursing facilities, which means, Jung said, the three major risk factors regarding coronavirus here in Korea is nursing hospitals and nursing facilities, resurgences abroad, and the concern of rising traveling and events in the autumn season, including Halloween, which is coming up.
Right. Okay, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
If in fact more and more people are getting better, he says that we're learning to live with it. People are learning to die with it.
It's not my fault that he came here. It's China's fault.
Anyone who's responsible for not taking control, in fact, not saying I take no responsibility initially. Anyone who's responsible for that many deaths should not remain as President of the United States of America.
Authorities in the U.S. have been recording fresh daily highs in COVID-19 cases in recent days. Now, according to a Reuters tally, the world's worst-hit nation saw more than 84,000 cases last Friday and over 79,000 infections this past Saturday. Indeed, the pandemic has emerged as a key election issue, and in today's studio session, we explore the stance of each presidential candidate with regard to this health crisis. I have visiting Professor Jun-seong from Yonsei University. Pleasure to have you back, Professor An.
Thank you.
And I also have Professor Youg-jun from Hallym University.
Thank you.
Good to see you again, Professor Che.
Thank you.
And joining our talk virtually is Catherine Ellen Foley, a health journalist over in the US. Hello again, Catherine.
Hi, thank you so much for having me.
Right, Catherine. Now, before we delve into the details shared by the two US presidential candidates on COVID-19, Catherine, do start us off with the pandemic situation over in the US.
Yeah, so unfortunately, it appears that we are entering what seems to be a third wave, if you will. We had really high cases, of course, back in March, and then we had a little surge over the summer as more and more people started going out. And now that it's getting into the colder fall and winter months, it seems that cases are surging again. So this past Friday, we had our highest case count ever, which was 80,000 new cases in a single day. Lots of hospitals, especially those that serve rural areas, are reporting nearly being full, which of course is very dangerous as cases continue to go up. And a recent report from the U.S. Centers of Disease Control and Prevention said that at the rate that we are going, it'll likely be between 235,000 and 247,000 deaths by mid-November. So just about a month or 3 weeks away from now. So unfortunately, the pandemic does appear to be far from over here.
Right. Professor Che, how do you explain the alarming resurgence in the U.S.?
So, well, I think it is hard to say from outside, but from what we see from this field is that the contact tracing isn't really working well in many places of the world. So the purpose of the contact tracing is to actively finding someone who might have COVID, but failing to do so we can't prevent the COVID from spreading to the community. So I think that is the key reason why.
I see. Professor, and the first topic addressed during the presidential debate last week was COVID-19. How much of an impact does each candidate's containment strategy look to have on the course of the election?
Yeah, I think that's a very important case. Actually, I watched the video a few times. It's very interesting because it was the first big topic for the second presidential TV debate. And if you see the number first, right, that's in 2016, there's about 136 million voters, that come to the ballot, right? And then there's the as of today, about 8.5 million confirmed case reported in the United States. So if you do the math, it's about 6% of the active voter in the United States had the case, the conviction case, the case. So that means that's a big number, considering the fact that there was about a 2% gap between the Trump and Hillary Clinton 4 years ago. So there's a big number. So it could be a game changer because that it's a quite big number, a number of American voters took this situation personally because someone they know had infected or someone actually passed away. Right? But that's a very important case. Also, if you see the Trump perspective and then Biden perspective, different, right? Biden perspective is Trump perspective, you see that COVID-19 is a global problem. And right, so and basically he's saying, his administration has handling the situation very well, such as the effectively or significantly lower death rate in the United States, right? So there's much about 1/10. That's what he said during the TV debate, right? However, the Biden, right, he kind of emphasized the number of total deaths, not the total rate of death, right? Total death rate. So it's about over 220,000, right, so far. So it's kind of emphasizing over here. And also he talked about the setting up the national standard to cope with situation. I think this is more like Biden was keep talking about national standard and wearing the mask. I think there's two kind of strategy from the Biden side.
Right. Well, up next, we take a moment now to listen to the actual words of US President Donald Trump and former Vice President Joe Biden with regard to the pandemic during their presidential debate.
It's not my fault that he came here. It's China's fault. And you know what? It's not Joe's fault that he came here either. It's China's fault.
A whole range of things the president has said. Even today, he thinks we are in control. We're about to lose 200,000 more people.
I want to open the schools. We have to open our country. We're not going to have a country. You can't do this. We can't keep this country closed.
No, I'm not shutting down the nation, but look, you need standard. The standard is if you have a reproduction rate in a community that's above a certain level, everybody says, slow up, more social distancing.
We have a vaccine that's coming. It's ready. It's going to be announced within weeks, and it's going to be delivered.
We're about to go into a dark winter, and he has no clear plan, and there's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.
Right, Professor Allen, President Trump is blaming China for COVID-19, while Mr. Biden is finding fault with Mr. Trump's lack of plan. What can you tell us about the respective strategies of these two candidates in addressing the issue of COVID-19?
Yeah, during the TV debate, Trump used two terms, responsibility and fault. And he said he took full responsibility, like for deaths of the Americans, right? However, he blamed China not to effectively contain the virus within the country, right? So basically, if we say, well, it's not my fault and it's not Joe's fault, it's China's fault, right? So, but it's the U.S. presidential election, it's not the, the Chinese election, right? So I guess that's what he's trying to say, is blaming each other, right? And then, however, I think the Biden point is that he stressed the point that the failure of initial response by the Trump administration. He said that he's arguing that that's failure of initial response has caused the higher rate of deaths in the United States. I think that's his point.
Right. Catherine, yesterday, that would be this past Sunday, White House Chief of Staff Mark Meadows announced that the Trump administration is not going to control the pandemic. Now, the administration claims it will seek to control vaccines and treatments, but not the contagion. How are pundits and people in general there responding to this stance and perhaps also to Mr. Biden's stance for a tougher containment strategy?
That's a great question. And I think what it comes down to is you can characterize President Trump's current response or lack thereof to the pandemic as something that more favors the U.S.'s economy. He's really prioritizing keeping everything open, making sure that people can keep their businesses open and go out and about as they need to. Whereas I think it's fair to say that Mr. Biden, Vice President Biden, is suggesting a strategy that scientists would be more in favor of. He's been very emphatic about using masks in public and mandating masks, especially when we see case counts going up. He has also been a big advocate for closing down schools and other areas as case counts have gone up. So I think really if you look at the two different priorities of Trump's trying to prioritize the economy versus Biden is really doing a lot more listening to scientists and what most doctors, pretty much all doctors would recommend are valid steps to maintain or to lessen the burden of the pandemic.
Right. Professor Che, as a doctor yourself, what are your thoughts, or how would you assess the Trump administration's containment efforts so far?
So I think there are a couple of points that we could discuss. Like minor points would be like there might be too little testing of the virus, especially in the early on, or there might be a little personal protective equipment for the healthcare workers and the general public. But I think the most important thing that might be comparable to some other countries would be we need a national leadership that addresses the important public health issues like wearing the mask, doing the social distancing and isolation and quarantine and so forth. I think that those are the main differences between the other countries.
Professor An, Mr. Trump has denounced lockdowns while Mr. Biden is calling for a slowdown. Now, Mr. Biden has clarified he's not calling for a shutdown, he's calling for a slowdown, highlighting the importance of face masks and social distancing. How do you see these stances as affecting the course of the presidential race?
Yeah, actually, I mean, the point is that the Trump point is that you have to live with it, the COVID-19, and then you cannot live in the basement, right? That's what he said. And then, as you said, I think the Biden point is that it's not actually the complete lockdown of the United States. I mean, America is more like, I say, it's like slow down the process. So I mean, the national standard itself will slow down the speed of the pandemic situation in the United States. So I guess it's a political question. They talk about the same thing because I think both candidates are trying to slow down the process, right? I think they're using different words to describe, but I think they're talking about the very similar things.
Catherine, meanwhile, what appears to be the public view to possible lockdowns and face mask mandates, that is?
That's a great question. So I think the answer really depends on where you are in the U.S. So in urban areas, believe it or not, most of Washington, D.C. Counts as one of these urban areas. Everyone is disappointed about the potential of more lockdowns, of course, but everyone is also generally more on board with it and more comfortable wearing masks and practicing social distancing. I think the real difference of opinions is where you go to some of these more rural areas where I guess there's less of an interest in wearing masks and social distancing and even less of an interest in lockdowns. I think everybody is disappointed that this is the prospect that we face. I think there's just a difference, I guess, in the attitude of the two groups. You have one group of people in cities who are willing to make those kinds of sacrifices for the greater good of public health. And you have other folks in other areas who are a little more hesitant to adopt those strategies as there's still a bit of, I guess, concern that might hurt the economy and disrupt normal life even more than it has been already.
Right. Professor Che, there are observers who believe that the pandemic is being politicized. How do you respond to such concerns?
I think the pandemic usually poses some political issues in many places, like historically from flu to SARS. But I think the response itself should be in the context of the scientific background, I think. And of course, we know that the US is the best public health and medical resources. And I think the role of the politics has to listen to the science and assess what is best for the public and do what is the best for the general population and so forth. I think that part is the answer.
I see. Professor An, President Trump was diagnosed with COVID-19 earlier this month and then declared virus-free in a span of a few days. How has his infection and subsequent recovery affected his approval ratings?
No, that's a very interesting question, right? Because I would think about that issue, right, also, right? But I think that this kind of both sides is if you see that the infection rate maybe because of his confirmed is higher, right? There's a higher infection rate. However, it's a higher recovery rate as well. But constant Fed, he's the U.S. president, right? So I'm sure he's the best treatment by the best doctors by the in the world, right? But anyway, this means that basically I think that I don't think it's a big impact, and depends on your political line. If you want to go with the Trump, I guess they will say focus on his recovery. If you're the other side, we'll focus on the infection side, infection rate higher. And if you're the other side, we'll say recovery rate higher too. So I guess it depends on perspective, right?
I see. All right. Well, Professor An, as always, thank you for your thoughts. Professor Che, thank you for being with us today. And over in the US, Catherine, thank you for joining us live through Skype.
Thank you for having me.
Right, well, that ends Monday's edition of COVID-19. Be sure to tune in tomorrow at this hour for more on the latest medical information on COVID-19. In the meantime, do take care and thank you for watching.
South Korea's response to the COVID-19 outbreak has been quick and relentless, always finding ways to improve its quarantine system. We've seen drive-through and walk-through testing facilities, but now there's even an unteched screening center. As the COVID-19 protracts, the front lines are changing.
From checking in to testing, all procedures are performed without any direct contact at the unteched screening center. Those who need to get tested for COVID-19 first check in using the kiosk. Then, they give their information to the medical staff from the other side of the glass window. The screening room has a thermal sensor on the door that opens automatically when a hand is placed in front of the sensor. The actual test happens across a glass screen. Medical workers will put their hands in the gloves to obtain a sample, which is submitted by the person getting tested and not the staff. During the entire procedure, there's no direct contact between the person getting tested and the medical staff. This means that medical workers do not need to wear heavy protective clothing.
일단 레베들 방호복을 안 입고 있다는 게 제일 편하고 좋고요. 오염에 크게 걱정하지 않고 자유롭게 다닐 수 있다는 게 되게 제일 좋습니다.
An unteched screening center that's safe for both healthcare workers and those getting tested. Amid a protracting COVID-19 outbreak, this new testing center will reduce the strain on medical staff and help stop the spread of the virus.
Contactless technologies are being used in the fight against COVID-19. While we have to be thankful for the progress that's been made in our quarantine system, I'm sure we're all waiting for the day that the virus will no longer be a threat. The best way to overcome COVID-19 is to stick to the basics.
Overcoming COVID-19 together. Let's all stick to the basics.
Jun-ho, Parasite.
Arirang, what matters?
Consumers these days are increasingly interested in eco-friendly and natural ingredients. Dr. B.O.B. is increasing the value of its company with products that consist of natural ingredients. We explore Dr. B.O.B., which captures the hearts of all consumers with its baby-friendly skincare brand. Dr. Biobi's mission is to create a world where everybody's happy. In order to make good products, the company has been heavily invested in developing quality health and beauty products.